Hello, everybody. Welcome to our webinar, California's Active Transportation Program, Writing a Compelling Statement of Need. My name is Jonathan Matz. I'm California Senior Policy Manager at the Safe Routes Partnership. First and foremost, we just want to send our best wishes to all of you attending, your families, colleagues, loved ones during this COVID-19 crisis. As I'll explain in a minute, it's shifted our plans a little bit for this webinar, but we also wanted to let you know before we get started here that we at the Safe Routes Partnership have been posting a series of blog posts on our national website, focusing on how safe routes practitioners and active transportation advocates and agencies can continue the work of promoting safe and active travel in vulnerable communities, even during this time of shelter-in-place orders. I put links to each of those posts in the end of my slides for this webinar, which you'll see. So please do peruse those. We hope you find them useful. A little bit about us at the Safe Routes Partnership here. You can see our mission statement. We are a nonprofit organization that advances safe walking and bicycling and rolling generally, including on scooters, wheelchairs, the like, for children of all races, income levels, and abilities, and see that as a pathway, one of the pathways to fostering healthy communities for everyone. About this webinar and this webinar series, this is actually the second in a series of 3, focus on California's Active Transportation Program, and in particular, our goal is to tailor it first and foremost to first-time applicants, maybe under-resourced applicants who have applied before and not been successful, or considering applying for the first time in this cycle. Oops, sorry. We published a guide to the ATP in fall of 2018. You'll see the link there in my slides. And by the way, all these slides will be available after this webinar is over. Early write things down, you'll be able to, when we're done. The next webinar is yet to have a specific date, but it'll be a pretty straightforward explanation of what's changed in the ATP guidelines and scoring rubrics from cycle 4 and cycle 5. So if you're a second-time applicant or frequent applicant and just kind of want to get a brush up on changes that you should be on the lookout for, we'll be going over that in our next webinar, which will be either sometime towards the end of this month or early into the next one. About me, I put my full bio here. I've been at the Safe Routes Partnership for going on 3 years. I joined California Senior Policy California Statewide Policy, and in particular, the main program that we're invested in California is the Active Transportation Program, which is what brings us all here. We, the partnership, have had a seat on the advisory committee since it was founded, and I've personally filled the role since 2017, in which capacity I've had the opportunity to participate in some working groups within that structure on forming ped and bike counts, non-infrastructure applications, the plans application, as well as the new quick build pilot project, which is a new feature in cycle 5. We also provide in-depth technical assistance to under-resourced communities applying, a total of 7 over the last couple cycles. And as I mentioned before, we published a guide to the ATP in 2018. About our presenters, we have 2 with us today. You may have seen in the announcement a third. I'll just briefly touch on that. Our third presenter was going to be Tracy Betancourt of the city of Chico, who was going to talk about some of the tools that she used in her successful cycle 4 applications. As we've been seeing happen quite a lot across the state and across the country, she was pulled into emergency management for the city of Chico around COVID-19, and will not be able to participate with us on this webinar. We've conveyed our thoughts to her and really to all of the very hardworking city staffers who are maybe being who, because of circumstances, are having to work on things that maybe are not their traditional role in the small cities in which they're employed. But I will be doing my best to go over a little bit what she would have presented at the end. We are still privileged to have two, however, very interesting and qualifying presenters here. First up will be Meghan Pendrocelli. I hope I'm getting that right. Meghan from the California Transportation Commission. And she's particularly been very active on the ATP. She joined the commission in 2015 and has been deeply involved in the development of ATP guidelines and scoring rubrics and applications. She has personally reviewed almost or more than 500 ATP applications over the cycles after the evaluators get a first pass. And so she has a pretty keen eye on what to look out for and how to do well on the ATP. Bill Sadler is actually a predecessor in my position, but for the last almost 3 years, I believe it is, has been at the Public Health Alliance of Southern California, where he currently serves as Director of Operations. The Public Health Alliance is a coalition of 8 local health departments, and in that capacity, he has helped Alliance members advance policy and systems change on population health and prevention. And he continues to be involved in the ATP, and also, like me, serves on the ATP Technical Advisory Committee as a public health representative. He'll be talking about a tool that Public Health Alliance released before the beginning of last cycle, and which is now an accepted statewide disadvantaged communities metric, and that's the Healthy Places Index, and how it can be useful in talking about the statement of needs. So before I turn it over to Meghan, just a little briefer on why we decided to focus a webinar on this particular part of the application. Going into cycle 4, there was a lot of interest among ATP stakeholders to really try to solicit more detailed and more locally specific answers to the public health questions on the ATP application. Furthering public health is one of the statutory goals of the program, but we're nevertheless finding that there was a kind of a heavy reliance on national public health metrics, and we wanted to use the application to prompt applicants to talk more about the specific health concerns in their local communities and how their proposed project would address those. And we saw some good responses from that in cycle 4, but we really wanted to take the time to talk about some best practices for approaching that question going into cycle 5 now. So Meghan, I'm going to turn it over to you.
Thanks, Jonathan. And you actually brought up something I'm going to be talking about, so that was a good segue into my presentation. Okay, so good afternoon. My name is Meghan Pendrocelli, and like Jonathan mentioned, I'm a program analyst at the California Transportation Commission, and the main program I work on is the Active Transportation Program. I'm going to be spending my time reviewing what is in the application, the scoring rubrics, and generally going over what we will direct evaluators to look for in the training, as well as some do's and don'ts for answering the public health portion of the need question. So first, I want to review the infrastructure application question for the need. For cycles 1 through 3, the public health was its own question, and most applicants really struggled to answer it in a meaningful way, which then led evaluators to not really know how to grade it, and it was just not a useful question in discussing the need for the project. Because of this, for the 2019 ATP cycle, Commission staff, with input from the Technical Advisory Committee and the work group, decided to fold the public health question into the need question. This allowed applicants to think about public health in their community more clearly and as a way of showing that there is a clear need for more active transportation to improve public health. The need question is broken up into two parts. Part A, the applicant is to describe the need of the community, and Part B, the applicant is to say how the project they want to build will improve the needs of the community that they addressed in Part A. So reading the question, it says, describe the issue or issues that this project will address. How will the proposed project benefit the non-motorized users? What is the project's desired outcome? And how will the project best deliver that outcome? Part A asks applicants to show the needs of the community that will be impacted and asks them to focus on three aspects of need: connectivity, mobility, and health concerns. This question is really the applicant's first opportunity to introduce the evaluators to their community and the challenges it faces. Specifically for the public health, it is asking about local public health concerns that the community is facing, whether that is obesity, asthma, diabetes, etc. In addition, it is asking for some type of data to further prove those local health concerns the community is facing. So now that we know what the application says, how do the scoring rubrics explain how points will be given? I've gone through and pulled a few key points I wanted to highlight from the scoring rubrics and explain how they should guide you in writing your narrative. The first one is specific local public health concerns. And this was really a big change from cycles 1 through 3, where most answers to the public health question read something along the lines of, America has an obesity rate of this, and walking and biking will decrease that because exercise helps you lose weight. While that may be true, the project is not going to affect all of America. The project is impacting one community, city, or county, and that is what the focus of the health concerns and health data in your answer should be. The next one is inclusion of health data at the smallest geography available. Now, for different agencies, local may mean different things, which is why this line is included in the scoring rubric. While some areas may be able to get health information for their specific city, some cities and agencies have to rely solely on countywide public health data. As long as an applicant can explain that countywide information is the smallest geographical area they can obtain, the applicant will still be able to receive full points for this section. Just make sure to note it in the application that the reason why you are using countywide health data is due to a lack of data at the citywide level. The next one is health concerns among targeted users. This is really asking the evaluators to look at if the applicant is discussing the community that will be impacted by the project. So make sure if there is a clear set of targeted users, you are addressing them. If this is a Safe Routes to School project and the applicant never mentions the health conditions or fitness tests of the students at the targeted schools, then they are missing their key targeted user. If this is a Safe Routes for Senior project, but the narrative focuses solely on the nearby college, then again, they are missing the targeted user. Think about who will be using this project the most and will be getting the most benefits from it, and put your focus on them. You should still be thinking about the entire community, but don't lose sight of who will be using and benefiting the most from the project. The next one is the need for the project in the disadvantaged community when applicable. If you qualify as a disadvantaged community and discuss the direct benefits the project will have on the disadvantaged community in question 1, be sure you discuss the public health concerns of that community. Disadvantaged communities often have an increased burden of public health concerns, so make sure you address that. And this really goes for the entire application. If you claim benefits to a disadvantaged community in question 1, your answer throughout the application should address that community's involvement and projected benefits. Next, we have a comparison to statewide and or countywide health data. So you've talked about local health concerns of the targeted users. Now you must explain how this compares to your county and or state. This is where applicants get points for having a more severe need. Areas all around the state have health concerns, but how severe are they? This is where Healthy Places Index can really come in handy, since it gives comparisons such as, this community has less healthy living conditions overall than 90% of California census tracts. Applicants need to be sure to include that comparison because without it, evaluators are not able to really understand how severe the need is on a county or statewide level. This program is incredibly oversubscribed, so there is clearly a need throughout the state, but where is it needed the most? And that's what this gets at in the scoring rubric. And lastly, remember that when you are working on these applications, the larger the project cost and fund request, the more that is being asked for. The large infrastructure application not only has the most questions, but also has the most detail as to what is being looked for in each question. Remember that the amount of detail and information being asked for is directly related to the size of the projects. Evaluators will not be asked to look for the same amount of detail and information in a project requesting 1 million as they would for a project requesting 30 million. Make sure that if your project is very large, you are not only hitting all of these points, but doing it with backup information and data and detailed answers. Remember that this is a narrative and everything should work together to paint the picture for the evaluators. The clearer the narrative is in describing the need and how the project will address it, the better the scores are going to be. So now I wanted to go over some do's and don'ts when writing your narrative question. So the first one is, do address the public health need in the target community. I know this first bullet sounds very basic, but the biggest need I can tell applicants is to simply answer the question. I cannot tell you how many phone debriefs from cycle 4 had the discussion that evaluators noted little to no discussion of public health. Remember, public health concerns is one of the 3 main points to hit in the need question. So by not addressing it at all, applicants are essentially giving up a third of those points right off the bat. And with how tight the scoring has been, that could be enough to knock you out of funding range in just the second question. And really in general, when writing your application, if the scoring rubric or application says to address something, make sure you do. The next one is don't use national health statistics. Again, the health statistics you present should be at the smallest level possible. And while citywide data may not be possible, everyone has access to data smaller than national numbers. And if all you give are national numbers in your application, you should not expect the evaluators to grade it that highly. Next, do reach out to your local health department or community-based organizations. Reaching out to your local public health department can help strengthen the numbers you have or get from the Healthy Places Index. In addition, some community-based organizations have done surveys and outreach on health in their community. This also helps show that there is a community-based support and buy-in, and that health is a real concern and factor for your community's interest in this project. Now, I do want to put a disclaimer in that commission staff have been getting a lot of feedback about the current COVID-19 pandemic and how it's affecting agencies' public participation and ability to work with other agencies such as their public health departments. So we understand that right now things are very fluid, and I'll put a reminder out that April 8th, the commission will be holding 2 workshops, one to discuss timely use of funds and one to discuss the schedules of the SB1 competitive programs. But I wanted to keep this in here because the applications will eventually be due, and hopefully by then applicants will have more ability to reach out and work with these organizations in a productive way. The next one is do use school fitness data whenever possible. This data can help on 2 levels. One, it gives more health data and can be an especially strong argument for safe routes to school projects or infrastructure projects that have a non-infrastructure component that is targeted towards students. Plus, every public school in California is required to do fitness tests for students in 5th, 7th, and 9th grades. So this is one area that regions across the state, regardless of size, can obtain and use. And 2, the need question has 3 points available for showing a benefit to students. And this is one way you can tie in students into your answer. If your project will in no way help students of any ages, do not include it, but otherwise reach out and report on that data as well. Next, don't be afraid to describe health outside of the norm. Most of the answers revolve around increases in public health as far as physical fitness and asthma are concerned. And it makes sense. Those are two very clear-cut health concerns for most communities, and there is a clear tie to how active transportation and mode shift can improve those areas. And I am in no way suggesting not to discuss those in the application, but there are other aspects to public health. Some communities have concerns specific to them, like those that have high numbers of valley fever. Discuss that because it makes your application stand out. Another one that people have discussed is access to parks and other outdoor spaces. Applicants have discussed how their project will increase park access, which has been linked to both physical and mental health increases. When thinking about health, don't be afraid to look at your community and discuss their challenges in all aspects, not just the most obvious ones. And lastly, if you have a non-infrastructure component with your infrastructure application that ties into your project and can tie into increases in public health, be sure to mention it as well. Non-infrastructure components can show the evaluators there is even greater commitment to this project and its success after it is built. So be sure to highlight it, especially if it will promote public health or is being done in conjunction with the public health department or a community-based organization. And lastly, I wanted to make sure to give a shout out to the Active Transportation Resource Center. It has a ton of great information, webinars, and technical assistance that you may need while working on your application. Now, some of you may notice that Emily Abraham's contact is not listed on here, and that is because she is now on maternity leave. So if you have questions, make sure you reach out to Summer Anderson Lopez. This is my contact information, so if you do have any questions, please reach out. However, know that now that the application is out, the commission staff will not be able to review old applications or answers for applications coming forward in the 2021 ATP cycle. So that is all I have for you. So I will relinquish the remainder of my time to Bill. Thank you.
All right, thanks, Megan. I'm just pulling up my presentation. 1 second. All right, whoops, wrong screen. Hold on. Okay. There we go. Okay. So thanks Megan, and thanks to everybody for joining today, and thanks for inviting me to present. I'm going to present specifically on the Healthy Places Index tool for you all, and Megan had talked a little bit about the applications for ATP. So I'm going to walk through just some of the practical applications and how you can use it for the application. So first, I know Jonathan introduced the Public Health Alliance, but I did want to just give an overview of who we are. And so we're a coalition of local health departments in Southern California, the 8 listed here. Collectively, we have 50% of the state's population. So we have a lot of people down here in Southern California, as most of you know. And our vision is vibrant and activated communities achieving health, justice, and opportunities for all. And our mission is mobilizing the transformative power of local public health for enduring health equity. And this is just an overview of how I'll go over HPI. At first, we'll go over a little bit about the history and methodology and the key features and functions, just to keep let everybody who doesn't know already kind of how this tool came about and what the features are. Then I'll go specifically into using it for ATP applications. So the Healthy Places Index. It's available at healthyplacesindex.org for those of you who have not used the tool and don't know where it is. So if you'd like to follow along or just play around with the tool while I'm presenting, feel free. It'll help with Q&A if you have any, or even after if you have specific questions for me. This is kind of what the map looks like, and the color scheme. The areas in darker green are places with healthier community conditions, and the areas in darker blue are areas with less healthy community conditions. We've kept the tool in a positive asset-based frame. We wanted to really make it more of a positive tool for health instead of a negative frame. So we kind of refrain from saying the places are less healthy and trying more focus on the places with healthier community conditions, and in terms of the framing and turning things around to be more positive. And the tool is aligned with the social determinants of health. So I've placed the CDC's social determinants of health side by side with our policy action areas. So most of you are probably aware with what the social determinants of health are, but just in case you're not, this is kind of a depiction of the environmental and community conditions that impact health. So it's things like the neighborhood and built environment, and health and healthcare, social and community context, education, economic stability. And we, in the Healthy Places Index, have grouped these together into these 8 action areas of economic, education, transportation, social, neighborhood, housing, clean environment, and healthcare. And you're probably wondering what makes HPI distinct from other tools out there. I know there are a lot of different tools that provide health data. I know there, including ATP, there's CalEnviroScreen, and there's other tools that you've probably come across in your work. And we really see that there's 3 unique things about HPI. The first is the granularity of the data. We have a lot of this data down to the census tract level across the state of California. So we only included data sets in the actual HPI score, and a lot of our additional layers that we have on the map are available down to the census tract. So you can get data at that fine level, and we also have that data at the city level, county level, different neighborhood data. We have legislative districts. We're working on zip codes. We don't have that in there now, but we've got a lot of granularity with the data. The second is that it's linked to policy solutions. So we have each indicator that is in the HPI score, which I'll go into in a second and show you all of them, is supported by policy solutions. So if you click on a link and, for instance, active transportation or active commuting is one of the indicators, you'll see it'll link to policy guides that give you ideas for ways that you can be improving active commuting or improving conditions for people who are active commuting, or for housing. We'll provide links to policies that different jurisdictions are exploring to be improving housing. So that's another unique feature. Finally, is that all the indicators in the HPI score are linked to life expectancy at birth. So they show strong correlations with life expectancy at birth. So that's kind of the grounding feature of HPI, because that is kind of a basic health outcome, just predicting life expectancy at birth, and it does vary drastically by community. So now I'm going to show you a little bit of how the map works. So here you'll see, if you click on the details tab, if you click on a certain community, here I have the city of Costa Mesa, and you'll see here that if you click on the details, you'll get this toolbar that comes up that shows where the area you clicked on ranks. So areas that have a lower ranking, like here of 15.7, have healthier conditions than just 15.7% of other California census tracts. So this is one of the less healthy census tracts in the state. This would qualify for the disadvantaged communities in the ATP application, as I'll go into a little later in my presentation. But you'll also see that there is additional information down below on different economic and education and the other policy action areas in HPI that you can click on here. And you'll see, if you click on each one, it'll pull up the actual indicators in the tool. So you'll see for economics that the economic score is 29.6. So there's a bunch of different scores that you can get when you peel back, because the 15.7 is a composite. So you'll see that there are certain policy action areas or indicators where the areas can score higher or lower. So here, the employment rate is actually pretty good, but the poverty rate is high, and the median income is low. So that's just another aspect of the tool. If you click on one of those, like poverty, it'll pull up a toolbar showing how it compares. And here's where you'll see more information. We show both what the indicator measures, but also the connection to health. And this part can be really helpful for your ATP application, because we already have narrative built into our scores for each indicator with a brief description of how it connects to health. And I know that that's kind of the thing in the application that applicants have struggled with in the past, is really linking the data kind of to the project. So this can help with that. And then below that, there's the policy actions, as I mentioned, that you'll see policy actions that can address it. So for poverty, there's policy actions around economic opportunity, and even transportation. So improving transportation access, economic opportunity. And when you click on those, they go to policy action, guys, as I'll show you in a second. And so here, these are all the indicators in the Healthy Places Index across all of the 8 policy action areas. And as I said before, well, except for there's 5 on the right that are climate related, that are climate vulnerability. They're not in the score, but they also were available. And those are the extreme heat and through sea level rise. But the rest of them are actually in the score, the HPI score, and they all have a correlation with life expectancy at birth. And so that's why these particular ones were included, in case you're curious about that. And if you do have follow-up questions about the weighting or methodology, we do have the technical report on the website, and I can point you to our staff that is more well-versed on those aspects than me, but that's kind of the summary of how these things were, why they were selected. And in addition to the data itself, I did just want to point out you can view data in multiple geographies. You can dive deep with some of the decision support layers we have, and that includes the health outcomes that I'll show you in a minute. You can also do ranking and define custom project areas, which would be really helpful for an ATP application. As well as you can upload your own data, and it's private to you. It won't be uploaded to our site for everyone to see, but you can make maps with just data that you have. So if you have point data that you want to include on a map and include in your application, you can do that. We also have how-to videos on our website. So if anything is unclear, we have a series of videos, some step-by-steps on each feature, and they're made for a non-technical audience. So I encourage you, if you just want to look and see how to click on certain things or just have more time with it, I really encourage you to go to the link on the screen and explore more there. So now let's get to the ATP, and specifically on the ATP application components. For one of the first things that you can do with the HPI is you can define your project area. So since we have data down to the census tract level, you can pool census tracts, and if that's where your project is located, in order to get a broader geography, or if that's like where your a thoroughfare is that you're proposing a project on, or where a school is. And so there's a pool function on the left in the panel, and you click on pool, and then it allows you to select a certain amount of census tracts, as you'll see here. And when you pool them together, once you're done, you press on pool census tracts, and it'll come up with a score that's the average of the census tracts that you pooled. So here you'll get a score that includes all of the census tracts. So that could be a useful feature as you're defining your project area, both for the disadvantaged communities, but also for the statement of need and identifying local health concerns. You can look at the whole area that you're proposing the project in. And so that will also show you the data specifically for each of these indicators as well. You can also rank communities. So if there's a certain aspect that you are trying to show within your city that this is an area of high need, you can rank them by all of these different geographies within your community. So if you have, if you're a city and you have multiple assembly districts or elementary school districts, or something like that, there are different ways that you could rank communities too to show the disparities in health outcomes. So just here, it shows you kind of how that will work. And then you get a listing, in this case, of census tracts within the community. And if you hover over the orange ones, that shows you which is the highest and lowest. And you can reverse that too, and click on that, and it'll reverse it and give you the highest ranked. So as I was saying, with identifying disadvantaged communities, this is just the language I'm showing you in the application for how you do that. You can use any of the census tracts that are in the 25th percentile or less. So those are the darker blue census tracts. So the darker blue census tracts would qualify as a disadvantaged communities in the ATP. So here in the city of Sacramento, this is a map of the whole region. So the areas in dark blue would be the ones that would count as a disadvantaged community. So those are the ones here. And now to the statement of need, as we're focused on in the webinar. So I know that we've already shown this on the screen. So this is kind of how the specific question looks. So I just wanted to highlight some of the health outcomes we have in HPI. These are not indicators in the score itself, but we've included them as additional data layers. So you can get all of these. This is just a sampling. I pulled out the ones I thought were probably the most relevant to active transportation. There's a lot more that you can look at as well if they're relevant to your community. But certainly, some of the chronic disease rates, life expectancy at birth as well, just if you think that is a good indicator. Obesity. We have pedestrian injuries as well, and that's the data from the state. So these are just some ideas that you might want to look at. And so here this is the map again. So to get to that, you would click on View Indicators, and instead of going to the HPI indicators, which is on the left of the panel, you would click on Decision Support Layers, and this is where they would come up. So health outcomes is the first one, and then there's health risk behaviors. There's also climate change layers in case that is something you want to look at. And other indices of disadvantage, we have free and reduced lunch, and some of the other parts of ATP application as well. We have some race ethnicity data too. But the health outcomes would where you would be looking for some of the more traditional health outcomes for this. So here you click down, and this shows some of the ones I just highlighted in the previous slide. So here is what it would look like with diabetes mapped on the map. And depending on your community, you may not have census tract level data for some of these health outcomes. It comes from the 500 Cities project, which is includes 500 cities. And so it includes a lot of California cities, but it doesn't include all of them. So if you don't have that, you'll get countywide data, and that's where it would be helpful. We previously mentioned about contacting your local health department to see if they can get more specific data for you, as well as using this data as well. We encourage you to contact them just to ground truth it as well, because this is a statewide tool, and it would be good to get more context. But in most places you can get this specific level of data in your county or city. And then I also wanted just to kind of go back to the social determinants of health and encourage everyone to think about the local health concerns with that context too. I know a lot of people really will go towards the obesity and diabetes or physical activity rates because that's the obvious ones and it's easiest to link to health. But some of these may be areas where you might want to think about how they link to health as well, and in terms of the broader community context. So if you look at any of these, active commuting is already on there, but we talked about park access or supermarket access or some of the economic indicators and how those relate to transportation access and housing. So thinking about some of those, we have the descriptive language for how these connect to health. So here's Sacramento again. If you want to look at like an area that's a disadvantaged community and be thinking about some of the education or transportation data and looking at how that particularly looks in terms of the health of that community. or neighborhood too. Neighborhood 1 is a really good one because it includes retail density, alcohol outlets, tree canopy, supermarket access, park access. So these are some other ideas to be linking to health. And then finally, I'll just show you some maps that Riverside created for their ATP grant in the last cycle when we were still not a beta tool, but we had just launched and we were kind of just missed the deadline to get the tool into the ATP program. But basically, they use maps to map out where schools are located and for their Safe Routes to School program. So this is just one example of how you can create maps in the HPI and use them in ATP. So I just kind of went through a lot and breezed through, but this is my contact information and the links to the map. And I'm happy to answer questions or direct them, after the call to if you've got more specific statistical questions or anything else that our team can help answer. So thanks so much for inviting me today, and I really hope that HPI can be a useful tool to you in your ATP applications.
Hey guys, Jonathan again. Sorry for that little break. Hopefully you can hear me and see me again now. Couple of things before I attempt to go over a little bit what Tracy Betancourt from Chico was going to mention. First of all, we have seen questions coming in on the chat, and we'll be getting to those as soon as I'm done here. And then also a hazard that you may be I'm sure many of you have grown familiar with over the last couple of weeks. We might have a little bit of background noise on my end in just a second with the needs of changing a 5-month-old. So please bear with me if that ends up being the case. So quickly to talk about, whoops, sorry about that, to talk about the City of Chico's successful ATP application in cycle 4. This was for an application called the Little Chico Creek Pedestrian and Bicycle Bridge Connector at Community Park. So this was essentially a project to adapt and build a bike ped bridge over Little Chico Creek, connecting one part of town where notably there is a junior high school with the disadvantaged community on the other side of the creek, from which a significant number of the population at that school came as well. And so this application, as I mentioned before, received a 92 out of 100 in the statewide competition, and therefore received funding. And they really knocked it out of the park on this particular question as well, getting 39 out of 43 available points. So I did not have the time to really touch base with Tracy about what she would have said had COVID-19 not disrupted her plans to be on this webinar. But one thing that we did notice in reviewing the application and really getting to Bill's point about using HPI in particular, looking at many of the specific indicators, they zoomed in on the score for the affected census tracts in the disadvantaged community, and were able to identify key barriers to access, including considerably lower access to automobiles than the rest of Chico, and greater reliance on the city's busing program, as well as significantly higher obesity levels and lower physical activity levels than the rest of the surrounding county. And also mentioned in the narrative as well, having reached out to the Butte County Public Health Department and relied a lot on that health department's community health assessment to look at the specific levels of physical activity for the affected children, as well as their ability to access district-provided transportation to and from the school, in which case a lot of them actually kind of fell into a little bit of a donut in the sense of being too far away to be able to or not far away enough, sorry, to in many cases qualify for the county provided and the district provided buses, but nevertheless also having a geographical barrier in the form of the creek and lower access to automobiles than other communities. So being in particular need for this kind of project. So they were really able to sort of both use the local indicators on a statewide tool like the HPI, mentioned a lot about the collaboration with, as I said, the county health department on going forward, and really their answer to the question shows a considerable familiarity with and knowledge of local health concerns, as well as a very direct linking of the proposed project to those concerns. As we go forward as well, or I'll show on the next slide, for the benefits of participants in this webinar, we've actually posted the Little Chico Creek application. It can be a little bit hard to find on the CTC website. So bit.ly link that you'll see there, so that you can take a look at that application as well and see some of the responses. I mentioned before as well that we have been posting blog posts on safe routes advocacy and practices during the period of COVID-19. And the links for those, as promised, are down at the bottom as well. So with that, I figured I'd get into some questions, and I'll start with some that came while previous panelists were speaking, and hopefully be able to keep up as they continue coming in. Let's see here. First question, is being a disadvantaged community a requirement in the ATP? No, it's not, although there are a lot of points available for projects that benefit disadvantaged communities. There's a statutory requirement that 25% of funds go to benefit disadvantaged communities. In reality, in every cycle, more than that. And in the last cycle, all of the funded projects did go to a community that was at least identified as disadvantaged by the applicant. Second question I see here is, county health departments are swamped with COVID-19. Are there online sources of data? There are, as I mentioned before, the City of Chico relied on Butte County's county health assessment. Well before COVID-19, our county health departments were indeed, in the business of producing locally relevant data and studies. Those are usually posted on the county website, county health department websites as well. But part of the purpose of this question is also to really kind of prod applicants to developing a collaborative relationship with their counterparts in public health. So seeking out that data and talking to those who compiled it and wrote the report, would also help inform, would help you come up with a particularly strong answer to the question as well. Third question, where can we go to find local school fitness data? Is that something from the school districts, or is it online or held in another agency? Short answer to that is it's a test that school districts administer, but the California Department of Education puts the physical test out and collects the results, and then provides the aggregate results back to the school districts. So the school districts receive the results back, And they provide students with their individual results, but they'll also report the summaries in their annual school accountability report card. So that information will be from the district themselves. We had a question, and this is kind of a general one. How current is the HPI data? I will maybe briefly turn it over to Bill if he can answer that. I believe the answer is that it's kind of depends on the indicator, but Bill, if you want to chime in quickly.
Yeah, sure. So we launched this version of the tool in 2018, and we used rolling ACS data for a lot of the data, which is the 2011 to 2015 data. So it is a few years old now. So basically, that data, we're hoping to update in the next 6 months to a year, and we're actually building in a longitudinal function. It won't be live during this application process, but in the future it will. And then the others, yeah, it depends on the indicator. There's some in there like tree canopy that we don't know when they'll be updated on a frequent basis. But at the time we had provided the most updated data. So it is a couple of years old now. So if there are certain things that have changed, just keep that in mind. But in general, it is, it's still pretty fresh depending on how you view the freshness of data, I guess.
Thanks, Bill. I also wanted to mention Marian Hernandez from the Active Transportation Resource Center put it in our chat, and thank you for doing so. Wanted us to remind all participants about the ATRC website. It's caatpresources.org, so CA as in California, ATP as in Active Transportation, resources.org, all one word. And there's a lot more information there about producing excellent ATP applications, tools and trainings there. There's just a fast training about working with California's Conservation Corps, and there was also a considerably longer, really in-depth webinar on using the Healthy Places Index, an hour and a half. I watched that one. It was really quite informative there. Let's see, we have 7 minutes left. Next question that came in for HPI for some of the counties, it shows a color percentile rating for some of the factors in diagonal lines for no data available, question mark. Is there a reason for this?
Yeah, so in some instances there was no data available, and particularly that's in it's either for rural areas or it's areas where there are group quarters or like military bases or other types of uses where we exclude, it's part of our exclusion criteria. But generally it was because the sample size wasn't large enough to provide data for those particular areas. But we think we have coverage for like 97% of the state. But yes, there are certain areas, so just because of sample size considerations or other considerations, there is no data for.
Thank you, Bill. Here's a question I think we might all want to take a stab at. I'll go first. Any tips for compelling statements for non-disadvantaged communities? The first one that I would say, generally speaking, and I give this answer without knowing the specifics of whatever project the questioner had in mind, would to be thinking broadly as well, that even if a project is not located within a disadvantaged community, if you can make a credible case for how it serves one, so for example, providing access to a major job center or something like that, that is also for consideration in the ATP application. It might be it's a little bit more of a complicated explanation to give, or it could be, but it's certainly an option available to you. And then, I would say more generally, using a tool like the HPI, which allows you to isolate specific indicators, might show that if the community that would benefit from a project is not necessarily disadvantaged in the whole, and it's kind of a global score, certain indicators might nevertheless indicate considerable need. And focusing on those, if your project has could specifically address those issues would be a good start. Megan or Bill, I'm not sure if you have other comments that you would like to get in on that.
I thought what you said was really great. I think just also building on that is the fact that a project doesn't need to be a traditional disadvantaged community by one of the factors that we qualify it as. It's not a requirement. And so just look at your community, because every community has needs as far as connectivity, mobility, and public health. So even if it's not a disadvantaged community, there are still things that your communities may struggle with or need infrastructure to help with. There are always important destinations in your community, whether it's grocery stores, parks, schools, libraries. So really just talk about that and how it's most important for your community and the health of their community. I mean, getting to a doctor's office, that is filling a need for public health. So I think just looking at what your community needs, regardless of whether or not it's a disadvantaged community, is really how you should be thinking about that part of the narrative.
Thank you.
Sorry,
go ahead, Bill.
And I'll echo that. Yeah, I'll echo that too. And I'll just say as well, if, in the HPI, even if your community isn't in dark blue and doesn't qualify as a disadvantaged community, as I was showing you, once you start to peel back some of the indicators, you'll see that almost every single community has something, where they are ranking lower than others. And so if you're really, if you're trying to find what your needs are, that's a good place to look, whether it's like a housing issue or an economic issue or education. It can help you make the link to health as well, and just try and figure out like what the angle is. And certainly I think just the access to destinations is a really key one for ATP. And so I think that's another just way to think about it.
Thank you. Let's see. Try to squeeze in as many other answers here as possible. Will other indicators like transit access be included in the calculation? So I know that public transit access is one of the indicators within HPI. And as Bill showed, you can sort of isolate that particular indicator. There's also something called the Housing and Transportation Affordability Index, which really, it looks at the kind of overall cost of housing and transportation on households, really looking at those two metrics specifically. And I know that some applicants use those tools to indicate, a heavy cost burden on transportation, whether it's through driving or through public transit, and have been able to, demonstrate the need for safe and reliable active transportation options, just based on the cost of transportation or cost of transit. So that's another tool, again, that's called the Housing and Transportation Affordability Index. Google that, you'll get right to it. It's an online calculator. Let's see, 2:59, so we'll be wrapping up soon. How competitive would an application from a local health department be? Well, we're working with a county health department right now on an ATP application. We think there's a lot of competitiveness in there. Generally, health departments work on the non-infrastructure side of it. We recommend as a best practice a collaboration between non-infrastructure providers and an agency that can pair that with infrastructure improvements on the ground. And then last question, or at least last one that I can see in here, Megan, there was just a question about the April 8th meeting that you mentioned to learn more about the new timeline. Question is the registration open to the public? I can answer that one. Yes, it is. But if you also just kind of want to talk about briefly what the subject of the workshop will be.
Yes, so there will be 2 workshops. The morning one will be discussing how we're dealing with timely use of funds, and kind of that'll be run by Christine Gordon and Teresa Fabula, and just kind of discussing, because they're working on guidelines to deal with some timely use of funds issues that we're going to be seeing as a result of the pandemic. And then the afternoon one will be discussing the schedules and any changes to the schedules for the SB1 competitive programs. So congested corridors, trade corridors, local partnership, and ATP. And that'll just be a discussion of what a reasonable new schedule would look like for those three or those four, and just kind of getting agencies' input on what is doable in the current climate. And yeah, the registration is up. We sent an email to our listserv, and I believe the save the date is now on our CTC website under the meetings and events tab. So the registration's open, people are able to go to that. And Jonathan, if you want, I can send you the link after this if you want to post it with this webinar as well.
Great. Thank you. And on that note, it is 3:01, so we're going to wrap it up here. As I mentioned before, all these slides, the full video of this webinar, as well as our slides, will be available on our website shortly. I put my contact information up there. If you ask a question in the chat and I didn't see it or didn't have time to address it, please just contact me directly, Jonathan@saferoutespartnership.org. And with that, thank you guys so much, Bill and Megan, for joining us. Thanks to all of the attendees. We hope you find this useful as you're pursuing ATP, and that you're able to continue pursuing the ATP in the current circumstances. Again, be safe out there. We highly encourage you to take a look at our Safe Routes resources for COVID-19, and there'll be more coming on that in the coming weeks. So with that, have a great rest of your afternoon. Take care, everybody.